Welcome to the Puritan Bennett 740 Setup and SST. We're going to demonstrate how to do these real quick. First thing we're going to do is plug it up into a red outlet. Hook up our oxygen with a quick connect into the wall or a power adapter on a flow meter that has one. And we're going to connect our filters. Arrow up. It's going to slide right into this big silver hole. That's the expiratory side. Then the inspiratory filter is going to go into this little silver hole. Next, our circuit. We're going to connect it. The expiratory side on the expiratory filter. The inspiratory side on the inspiratory filter. Make sure that this little piece is nice and snug or you'll have a leak. And then you'll connect it to your arm. Make sure all your pieces are together. And we'll turn it on in the back. This little black toggle switch. Turn it on. Now we will demonstrate the SST. We're going to go into our menu button. We're going to turn our knob to number 3, self-test, and hit accept. It'll ask if you want to do a short self-test. We will accept. And then the vent is going to warm. It's important to let the vent warm, otherwise your test may fail. Sometimes it will pass if you just let it warm a minute, but they do recommend you let it warm for 10 minutes. For time's sake, we're just going to let it warm for a minute and we'll see if it passes. Go ahead and clear to bypass the warming. And then it's going to ask if your patient is disconnected. Yes, accept. It's going to say to block the Y. Here's your Y. Make sure it's good and tight and blocked. Hit accept. Alright, it's going to ask if you want to use HME. We will hit accept. If you are setting your ventilator up, you can always change this in this mode to dual heated wire or no heated wire, which is what we use. But we will take HME right now because that's what we usually start out with. We are using adult tubing, so we're going to hit accept. We usually use a 7.5 standard, so we will accept the 7.5, and it's going to do a leak test. It says the test passed, but it's going to do some more. Do you want to do the IE filter test? Yes. Accept. Now you have to disconnect your inspiratory tubing. Hold your filter on there. Make sure you keep the filter on. hit accept. And now it tells you to reconnect the inspiratory tubing. So we'll reconnect it to the inspiratory filter. Hit accept. It says to unblock the Y. I'm going to just take this elbow out. And push accept. And I'll block the Y. So I'm going to push the elbow back in. Accept. Now disconnect the expiratory tubing. Leave the filter on there. Accept. Reconnect the expiratory tubing. Accept. And our test passed. So now that's the alarms. That's the main alarm. Accept. Medium alarm. Accept. No sound. Accept. That test passed. Our backup alarm. Accept. And the SST is finished testing and it passed. So now we're going to turn the ventilator off. And we will turn it back on. We're going to hit the menu again. Go to number 6, standby mode, hit accept. It'll ask you if the patient is disconnected, accept, and then we are in the standby mode. The important part of the standby mode is that this mode actually allows the internal battery to charge. So what you want to do is make sure that you keep your vent plugged up, you keep your vent turned on in standby mode, and you cover it with a cover, but you do not cover the filter in the back. Otherwise the safety valve will open, it will alarm. So we usually keep everything covered except for this filter. Another important tip about this vent is whenever you're cleaning it, you want to check these filters and change them. Make sure that they're clean. They just like one turn and pop off. And there's your little filter. And it looks pretty good. Make sure that your little fan area here is clean. And put your little filter back on. It probably could use a good dusting. You're going to stick this back in there. Delay an asthma attack. And then you're going to give them a turn. Sometimes they're finicky. They should pop right back on there. And that is 740 demonstration